Yeah, my name is Rejko Krüger. I'm a neurologist by training, and I came already more than 10 years ago to Luxembourg as a professor for clinical and experimental neuroscience. And I'm, in the meantime, also director for Transversal Translational Medicine at the Luxembourg Institute of Health. All that allows me to advance in my focus area, which is neurodegenerative diseases and movement disorders, to create a translational pipeline in a way, or translational cycle from fundamental research over clinical research and clinical studies up into integrated healthcare and also prevention of neurodegenerative diseases. At that time, it was really an opportunity to come to Luxembourg. You may know that the research environment is still developing and the university was quite new at that time. So I can even, in a way, tell that I accompany half of the life of the University of Luxembourg, because that is only a few years older than 20 years in the meantime. And it was at that time a challenge in a way to connect from what already was excellence in fundamental research. There was a Luxembourg Center for Systems Biomedicine founded at that time by Professor Rudi Balling. And he at that time needed somebody who can connect from the research institute out into the healthcare. So where people are actually seen as patients. And that was very attractive at the time for me. I was working in Tübingen at the University Clinic in Germany and at the Hertie Institute for Clinical Brain Research and at the University Clinic. And that was an opportunity to, in a way, bring knowledge from that academic institution into what is currently built up also in the overall context of medical education in Luxembourg, with research, with teaching, and with care. I think the major development was, and I highly appreciate, that we created a kind of interdisciplinary spirit and interinstitutional collaboration, which really generated a critical mass around one topic. And at that time, it was funded by the Fonds National de Recherche, the national funding agency, that allowed to create the first National Center for Excellence in Research on Parkinson's disease, where all the research institutions, so the LCSB with the university, the Luxembourg Institute of Health, the Laboratoire National de Santé, joined forces with the Integrated Biobank Luxembourg and with the hospitals. And the CHL was the hospital where we had the first so-called Parkinson Research Clinic founded. And that was the nucleus for inviting people from Luxembourg, but also from the greater region, to join our research as people with Parkinson's or as healthy controls. And that was a critical development, a very successful project that was funded 8 years, and that is now sustained in Luxembourg and shows that we created something that also will now inform other diseases and other research areas, how to, in a way, create an interdisciplinary, interinstitutional, successful environment to advance. Here I would like to give some context, because I told you about the National Center for Excellence in Research that was founded, and that helped us to advance from the research side on neurodegenerative diseases. But it was very clear from the beginning for us that we want to also have an impact on the everyday healthcare experience of people in Luxembourg. And in that context, we were able to pilot in an integrated care network for Parkinson's disease, which was called Parkinson Net and benchmarked from the Netherlands. And that is, in the meantime, even absorbed by integrated into the Luxembourgish healthcare system as a réseau de compétences, maladie neurodegenerative. And with the title neurodegenerative diseases, you already see that it is not only Parkinson's, but also includes dementia. And I'm also, since 8 years, coordinating a national dementia plan, the so-called Programme Démence Prévention. And here we invite people that have already slight, mild cognitive impairments to be analyzed, to undergo neuropsychological assessment, but also to map the individual risk factors. Because, and that's now really something that is a major achievement from research over the last years, we know modifiable risk factors for dementia. It means And this number is increasing. The latest publication from this year shows that there are 14. And if we only would act on all these 14 risk factors, we could already prevent up to 45% of all dementia cases. So in our individual program, where we invite people and where we can, in a way, provide them with precise interventions to attenuate their risk, we want to prevent people progressing in something that already started. But based on what we learned and based on the fact that in this program we have people with an average age of 68 years, we learned that we want to provide an earlier awareness that everybody can do something. And we know that many of these modifiable risk factors can be best addressed at the mid-age. So therefore, we created the Braincoach app. And we were also here again lucky to have partners that pioneered from the Netherlands. These were partners from Maastricht University. And they have a Netherlands brain coach. And we could adapt this one to the Luxembourg environment. So in French, in German, and in English, of course, also for the expat community. And it opens an awareness by asking everybody a questionnaire where you can already map a little bit your risk profile. And then you get individual incentive quizzes, challenges, where you can work on your individual risk in order to not only raise awareness, but also to change a little bit. It's all about lifestyle changes, right? We are sometimes in our comfort zone and not so open to change things. But here we can have a lot of impact with a small change. And that is something that we want to achieve with this app, which is cost-free and available in Google Play or in the App Store, so easily accessible. So dementia is a challenge worldwide. Luckily, we are all getting older, but with the increasing age, we also have a high risk to get neurodegenerative diseases. That refers to dementia, that refers to Parkinson's, and we see a substantial growth in both diseases worldwide. So we can really say that there are people worldwide that are affected in an increased manner. And we have to tackle that problem because it has also a big socioeconomic aspect. And we want to get, of course, in a healthy way, older. And the number of Parkinson's people, by the way, people with Parkinson's will double in the next 20 years. And we have a similar tendency still for Alzheimer's worldwide. So therefore, we need to consider what are means to prevent these diseases. Early signs is, of course, some forgetfulness. Many people have the impression that can be objectivized. So we can do neuropsychological testing, and in the program Demenz Prävention that I mentioned to you, we can invite people where there is already a measurable deficit. And here we ask people that feel uncertain to talk to their general practitioner, to their treating physician, and this person can refer to our dementia prevention program. And we have already more than 100 doctors that regularly refer patients to our program. And that's an entry point for first knowing, is there something? And that can be also reassuring that we don't find anything. But if there's a concern, if we measure some slight cognitive problems, we can already recommend things to avoid deteriorating, to avoid degradation. And I think that is important. And these are some very, intuitive things, like we should do more sports, more physical activity. And we should not underestimate how powerful it is. But there are also some things that are maybe not so well known, that if we well control blood pressure, well control blood sugar, avoid high cholesterol, that has also already a substantial impact. And there are also very new factors that, for instance, avoiding contact with air pollution, or taking care of the vision, that we have the right glasses, or that we have a hearing aid if we have some problems, that all can contribute to preventing dementia. Here I would like to introduce an interesting phenomenon or observation that was more and more unraveled by research over the last years, because what we realize or diagnose as dementia, typically in late life, is based on a process that most probably started already 10 or 20 years before. So that means, for instance, for Alzheimer's, we have specific markers that we can detect in the cerebrospinal fluid, but in the meantime, we can even read it from blood. And these markers indicate an ongoing process where nerve cells, in a way, suffer in the brain, and where sticky proteins, so-called amyloid, is aggregating. And that gets already reflected in alterations that was recently in a publication from China, tracked back 20 years even, before the diagnosis was made in specific individuals. That already indicates that we have to think earlier about prevention. And even if we would have a causative treatment, and first causative treatments emerge at the moment with antibodies, we may consider in the future when to apply them, because the process is already going on. So therefore, also considering the modifiable risk factors that I mentioned earlier, we have to be aware that we have to have a shift and at least already look into midlife. Honestly, education is also a modifiable risk factor. So better you are educated, and the longer you're educated, the lower is your risk to get a dementia later life. So there's even dementia prevention that starts in young adulthood to improve education options, right?
Yeah, that's fascinating. So would you say formal education, or would you say someone reads a lot of books, reads a lot of stuff, would be considered education in this context?
On the research side, it is really formal education, but I can tell you that what you mentioned with reading or with being cognitively active, this is already reflected in something like social activities and cognitive training, which also show to be effective for prevention. So all these kind of activities are good. You can imagine if you train your brain like a muscle, you have a higher capacity, you have a so-called reserve capacity that can protect you from later decline. I have to add that this blood test is not yet integrated into regular care. So what is integrated for Alzheimer's, for instance, is a test in the cerebrospinal fluid. So that needs a so-called lumbar puncture. And here you see that's already the neurologist that gets involved.
Right.
So typically in the sequence of events, if you have some problems, so if you feel already maybe having first symptoms, you should present to your treating physician. There he can decide whether that's something that should be followed up. And the specialists that would look into dementia and may add some cognitive tests and may fix the diagnosis, this is a neurologist or geriatrician that helps to support that diagnosis. The app is in a way constructed that it is a personalized app. So you have to indicate your name, your contact options, but that's of course data protected in that context. And then you get a first small questionnaire just to see whether there are areas of risk also that would be worth in a way being followed up. And if there's an indication that in a way we could help to improve lifestyle and to reduce the risk for dementia, you are invited to, in a way, inscribe, to connect, and then to fill out a larger questionnaire that is going more into detail, because then you are at the end presented every day a so-called NUT, and that NUT refers to a certain topic where the program identified a risk factor. You're also allowed to look into other risk factors that you don't have apparently. If you're interested, that's still open, but the program is designed to focus on the way where something to improve. And each domain that has been identified as a potential risk factor is represented by 15 different nuts. And this looks really like a whale nut, and that has also reason, because whale nuts are quite healthy. They have a good combination of fatty acids that are also beneficial. And these nuts you have to crack every day. And that can be a kind of quiz, that can be a challenge, like cooking a specific recipe, which is healthy. Or what I liked recently, I do it myself, as you can see. What I liked recently, that I was asked to do a hiking tour, and I was proposed some hiking tours in Luxembourg, where I really could see, oh, which is the one that is more appropriate for myself. So these are the things that you get proposed, or some important knowledge that you learn about how to assess food in a way that you can better estimate what could be more beneficial and what should be integrated into your everyday's cuisine. And but it goes also about, of course, you can imagine for people that smoke, to find strategies how to get rid of smoking. And all these kind of risk factors are consequently addressed according to your personal profile. We have a lot of positive feedback, and we like that it is really having feedback from the different language groups, let's say. We have feedback from people using the English version, the French version, the German version, and we have now a kind of stepwise launch. So we have now different communication activities, luckily, and I'm happy that I'm invited here also to present. So I hope a lot of increase in the English user group, and I can tell you then. But I think we have to really say that this is something that's a co-development. So also from the feedback we receive, we will adapt it. So it's already foreseen that we have a revised version in the future. So that is something that should stay and should be adapted to the needs of the people and also to the identified modifiable risk factors. Because I told you, over the last years, every 2 to 3 years, there was a new publication of an expert group worldwide in the Lancet journal, and they publish as a dementia group what are the newest knowledge. And here we know that we always can add new modifiable risk factors. So of course here we also want to be on top and will adapt with the newest emerging information. Healthy food is definitely something we can change already a lot, and that has been shown for Mediterranean diet, but it must not be if somebody doesn't like Mediterranean diet. Also, for instance, some Northern European diets with more fish, it's also very highly recommendable in that context. Some things that I was not so much aware of, and I also would like to stress that social disintegration plays a role. So going out, going to cinema, going to lectures, listening music with others, that's also something that can prevent dementia. And that has also a positive effect because it helps also to avoid depression, which is also a risk factor for dementia. So we see that some of these factors are even interconnected. And I think that's also something we should be aware that, and my colleagues and collaborators from Belgium pointed out to that. They said, if you act, for instance, on cardiovascular risk factors, you already have a benefit in the dementia prevention. So in a way, you have 2 and get 1 for free in a way, right? And I would agree, and we already realized that physical activity is very important. And I think some of the new digital tools prevent us from being physically active. On the other hand, we have to say that also some things that came with, how to say, improved living conditions also reduce the risk. So we know, for instance, that in countries like Brazil or India, that are still emerging countries, we have a much higher risk for dementia, like in, let's say, the classical European or North American countries, where we have already, at least in terms of medication, a better adapted high blood pressure, a better adapted or medical treatment for blood sugar. And so therefore, it's always a kind of complexity. But if we could turn all the different screws in the right way, we have to be aware that we can prevent more than up to 45% of dementia cases, and that is what no medication can achieve. And therefore, we have a very powerful tool in a way that is yet completely underestimated, I think. And that's something that our colleagues from the Netherlands even said, you're the medicine yourself, right? So if you do yourself, you can prevent already so much. You don't need an external medication at the end. Right? You can be, of course, reassured that it adheres to the data protection regulations, and therefore there's no data shared. And the only way we can use data as if you say you want to be informed maybe for future research studies, that like in a medical studies, a medical PI can get back to you and invite you for a trial, for a study, but then you need to sign up in the new study again and have to fill a consent. So that's completely according to the guidelines. Of course, our app has been also approved by the National Ethics Committee here, which is also very important for us. So first of all, I think it's important to know that this is for free. So we really want to incentivize people to use our app. The app should make fun. And I think there's a lot of things which motivate people to stay on that and to expect the next nut next day in order to crack and in order to learn more. It's about knowledge, but it's also about, in a way, keeping an awareness, raising an awareness. And I see also, and that's also what I liked from some feedback, that it stimulates discussion among people. And I think all that helps us to have a return to society, because at the end, that's what we all can influence. And it's not that we have to wait until we have first symptoms, but it's really that we have, and I would focus on the mid-age now for the moment, that we have really means in times where we feel very powerful, where we are all engaged in different ways, that we can already do something for our future in order to have a healthy aging later on. And that's our ambition.